Hello, I am Yogender. I am from Tumkur. My son is having an AVM problem, abdominal wall. From last 2 years, before we have consulted so many doctors, like in reputed hospitals, but nobody has given a conclusion or confident about the treatment. After that, we have decided to move to the Bangalore Manipal Hospital Whitefield. Then we met Dr. Anoop sir. Then first day itself, we have got a positive approach and positive assurance for us to about the treatment. After that, we have gone through the several treatment like embolization, then surgery.
Hi, I am Chirantan Singh. I am from Tumkur, 6th standard. I was suffering from AVM chest malformation. I was felt very sad because my friends in school were asking, what is it? So I had went to Manipal Hospital Whitefield.
Hi, I'm Dr. Anoop, the consultant vascular and endovascular surgeon in Manipal Hospital Whitefield. Once Chirantan came to our OPD and we found he had a large arteriovenous malformation. Since the lesion was very big, measuring about 10 to 12 centimeters, I was worried about the end result. So we thought we will approach it as a team. So we together, me, Dr. Nagbhushan, our intervention radiologist, and Dr. Ramani, the plastic surgeon, sat together and we decided that he needs proper evaluation. And with the evaluation, we had made certain plans.
I am Dr. Divya, resident in Vascular Surgery Department, Manipal Hospitals Whitefield. A child, 11-year-old male, Master Chirantan Singh, has presented to our OPD with complaints of swelling in his right lower lateral chest wall.
Now, on CT, we found that he had plenty of feeders coming off from the major vessels, which were all connecting into the lesion. So our plan was to do an endovascular first, see if the lesion shrinks in size, so that end of the day when we took off the lesion, the gap that we left after taking off would be easily filled up either by a skin graft or suturing. After the first sitting, which went well, as in endovascular we closed off most of the feeders we thought were feeding. We thought we'll give him a break of 3 weeks and then plan to do an intervention again after 3 weeks. But in 10 days, the mother called up saying that the child bled again. So this time we thought we can't sit and wait. We had to do the procedure immediately and take him up for surgery. So in the second sitting, we got a repeat CT. It showed that he had fresh feeders coming off from the femoral. So again, we went in endovascular. With the help of Dr. Nagbhushan, we were able to seal off most of the feeders. Post that, we didn't wait for too long. I and Ramani sat and decided that he will surgically remove the lesion. So 2 days later, we posted him for surgery, made sure that the whole tumor comes off, and then we were able to give him a good closure at the end of the surgery.
Hi, I am Dr. Nagbhushan. I am consultant intervention radiologist in Manipal Hospital Whitefield. When we analyzed Master Chirantan's CT scan, he had abnormal feeders from vast majority of areas. He had feeders from the arm, from the intercostal arteries, and from the lumbar arteries. So this was an extensive AV malformation with abnormal communication between the arteries and veins. So there were feeding arteries which were very large in size, up to 1.5 to 2 centimeter, with a high velocity of flow in them. And there were also the draining feeders, draining veins. They were also very big in size.
Hi, I am Dr. Ramani CV, consultant plastic and reconstructive surgeon working at Manipal Hospitals Whitefield. Master Chirantan's case was a challenging case. Initially, when we saw him at the OPD in vascular surgery department, Dr. Anoop had called us for the skin cover because the lesion was a big one, around 10 into 12 centimeters. And such huge arteriovenous malformations would definitely require multidisciplinary team approach. So we took the help of Dr. Nagbhushan, who is our interventional radiologist, and after the CT, we decided that we would block all the feeders so as to reduce the size of the lesion and then plan for excision and final skin cover.
So now this time the feeders were reduced in number, but they were still present. So we sat again and decided to go for a second setting of endovascular treatment. This time we could get almost all the feeders and we knocked off all of them with medicated plastic PVA particles as well as glue. And the result was quite amazing.
The whole difficulty of the procedure was the child was precious, only single child. Parents were very anxious, and they wanted, the child to have no major issues at the end of the day. So it was a lot of stress from day one to make sure that things go well. And because it was a team approach, all of us were involved, and we gave maximum effort to give him a good result. Touch wood, things went well, and he is doing well now.
So we have gotten a good result from the Dr. Anoop sir, Dr. Ramani sir, Dr. Nagbhushan sir, and Divya madam. Even nursing staff also is very cooperative. They are very encouraging. We have gotten a good result. We are very much satisfied with the Whitefield Manipal Hospital, Bangalore. Thank you very much.
I met Dr. Anoop sir, Dr. Ramani sir, Dr. Nagbhushan sir and Divya ma'am. They gave me a lot of confidence in surgeries and embolization. I am very thankful to them. I am very thankful to the staff too. Thank you.